So I wanted to talk to you a little bit about sleep apnea and snoring.
Okay.
Do you understand what sleep apnea is? Sleep apnea is when you actually stop breathing for a period of time while you're sleeping, okay? Snoring is a relative good indicator that you have some apneic events, all right?
Okay.
Obviously, if you have apnea, it's not a good thing because your levels of oxygenation of your blood going to your brain is much less, all right? So if you understand that concept.
Yes.
So we don't know if you have sleep apnea or not. We can actually find out. We can actually have you do the test.
Okay.
I did the test myself. I'll tell you my own experience, all right? I was falling asleep in front of my computer. The girls were laughing at me, making fun of me. The real big key day was when I was actually on my way home. I fell asleep at a red light. And I said to myself, I better test myself. And I did. So we can sign you up here for the test. The test comes to your own home. So you're doing the test in your own bedroom, all right? They do it for 2 evenings, okay? They're so careful that they actually give you a second set of batteries the second night because they don't want anything to go wrong. And what they're measuring is the number of times, if you have apnea, that you're actually not breathing, or if you have difficulty breathing, in an hour over the course of a 6 or 7 hour sleep period. They send you the test, you send it back to them. It's read by a board-certified sleep specialist. You and I both get the results, and then we can make you a device, which we'll discuss in a second. But let's talk about the test. The test, you wear a thing around your chest, all right? You wear a finger pulsometer, and you wear a nasal cannula that goes around your ear that measures the number of breaths that you're taking. You do this all evening, and it's nice because it's in your own bed instead of going to a sleep center, which you used to have to go to years ago, right? Come back, and the test is going to tell you how many times you are not breathing. If you're snoring, that's a good indicator that you have some apneic events because when you lay back, all right, all the muscles of your tongue and your throat relax and they go to the back of your mouth. They close your airway. That's why you're snoring. That's why you have apnea, okay? Now, the scale is, when it comes back, from 0 to 5, that's normal. From 5 to 15 is considered mild, all right? From 15 to 30 is moderate, and above 30, which is every other minute, you're not breathing. That's severe. But let's assume that you're in the 5 to below 30. Tell you what happened with me. I actually had a level of 18. That means 18 times in an hour I was not breathing, okay? And so what I did was I made myself one of these oral devices, and I'll show this to you in a second. And then I wore this very comfortably, and after 3 months I retested myself. Then I was down to 6 episodes. So this was a dramatic home run for me because I went from literally not breathing 18 times in an hour to only 6. I feel a sense of well-being that I haven't felt in years. I have energy. My wife was killing me because I was snoring. I'm no longer snoring like a train, and I feel much better. So this was a really, really good thing I did. Let me show you the device. What did I do? Here it is. So this is called a Herbst sleep apnea device. Let's look at this in detail, all right? The average person who, when their teeth come together, their lower teeth are behind their upper teeth, which is exactly the way you are, right? So now we're going to lay back, right? So Mr. Jones here, he lays back. I'm laying back. All the muscles of my tongue and throat go to the back of my mouth, close my airway up. So now we're going to change that. We're going to wear this device. This fits over your upper teeth and your lower teeth. And what we're going to do is reposition your jaw so that now we're moving your jaw out like that. We're not going to make you look like Jay Leno, but we're going to move your jaw out so that your teeth are now edge to edge. Now this model, I exaggerated. If you look at this, the lower jaw is out in front of the upper jaw. I just wanted you to be able to see it. But it locks your teeth in place. When you're here and you lay back, your jaw cannot fall further than edge to edge.
Okay.
Okay? What's also very nice about this is 80% of the devices that I make, we keep the patient in the position that we start.
Okay.
About 20%, we actually have to move slightly more forward, and this is a titratable, adjustable device. You see the little threaded screw there?
Yes.
I can move this arm forward, I can move this arm forward, so that after you wear this a week, let's say you are not getting the relief that you thought you were going to get. You're snoring less, we can still adjust it a little bit more. I'll adjust this for you. I can move it a millimeter at a time.
Okay.
And most of the time, with those 20% of the patients, we can eliminate their problems. And so this is the kind of thing that we would make. Now, the test, let's go back to the test. The test is covered by your medical insurance as well as this. What medical insurance do you have?
It's GEHA.
All right, so GEHA is a great insurance company.
Okay.
They will pay for the actual test itself.
Okay.
So all you're going to do is sign up with Karen. You're going to give her your medical card and your ID.
Okay.
All right? She's going to do the rest. She's going to send it into sleeptest.com.
Okay.
They will send you the materials.
Okay.
All right? And like I said, you wear it for 2 evenings. They're going to give you a self-addressed envelope, box to send it
Okay.
back to them, and then we'll find out what your levels of sleep apnea are. In the event, just in case your insurance doesn't cover this,
Okay.
the most that you will pay is $285
Okay.
because we contract them. The test is normally $1,500.
Okay.
We contract them, and so they allow our patients to get the discount. I'm pretty sure GEHA
Okay.
covers it, though.
Okay.
All right. I'm also pretty sure that GEHA will cover the cost of this device.
Okay.
All right. But before we even do anything, Sleep Test will call you and tell you this is covered or it's not covered. So you can write it, right ahead
Okay.
before you get it to see if you're going to have to pay for it. I think it's a good idea. You know that you're a snorer right now.
Yeah.
You don't know if you have any apneic events. I would do the test if I were you. I knew that I had to do it, and it
Okay.
dramatically changed me.
Okay.
Okay? Think you want to sign?
Yeah. I want to do the test.
To me, it's something that you figure 75% of the adult population has some sort of apnea.
Yeah.
I think we should find out if you do.
Okay.
All right?
All right. Thank you.
Thanks. And thanks for letting me do the video.